October is Breast Cancer Awareness Month. Breast cancer affects millions of people, their families, and our communities every year. And while breast cancer remains one of the most common cancers, there is always hope. Today we've got Beth Connor. She's a breast surgeon from Trinity Health here to talk to us about what we should know about breast cancer and the services offered there. Thanks so much for being here.
Thanks for having me.
Let's talk about the significance of Breast Cancer Awareness Month, why we do this every year, and what you hope people get out of this.
Yeah, so breast cancer awareness is super important, and that's because breast cancer is really common. 1 in 8 women will get breast cancer. So understanding your risks and then knowing when you should get screening can help us catch cancers sooner and have really good outcomes.
Yeah, and that's the key, right? Catching it sooner.
Yes, absolutely.
So let's talk about what, specifically women need to know about getting a mammogram, when they can start, why they need to do it, and how often they should be doing this.
So fortunately, some of the organizations that make guidelines around mammograms have really fallen into alignment to say that women should be getting them around age 40. Okay. So age 40 is when I would say to start. There are some people who can get them sooner. If you've had a family member diagnosed at a young age, we really think 10 years sooner than that is also a good idea. One thing that I think can be a barrier for women getting mammograms is thinking that you have to have an order from your doctor. And so at Trinity Health, you can actually just call us up and say, I need a mammogram, and what we call self-refer. So that's a really excellent way to make sure that women can get in for this important screening.
Yeah, that is a huge deal. You literally, if you're 40 years old and you're a woman, you can call up and be like, yeah, I need a mammogram, and they'll get you in.
Right.
So important. And then talk about the frequency of this. Like once a woman turns 40, I mean, is this something they should be doing every year? And talk about, are there any risks associated? Anything, misconceptions?
Sure. So I think people should be getting them every year. There is a little bit of debate still around that, but every year is really what's recommended. And then for some women who are at high risk, there are actually screenings that can happen even more frequently. Wow. And so getting your risk assessed so that we know the appropriate screening interval can be important. There is some very small risk with mammograms. They're definitely safe. So mammograms are X-rays, which means there's a little bit of radiation that you're exposed to with that. But there's also radiation that we are exposed to just going about our daily lives, and that exposure is about the same as a month of walking around that you get when you have a mammogram.
Okay, so not a huge deal.
Right, pretty safe.
So let's talk about some risk factors that women should be aware of. Obviously, genetics is one. Let's talk about some other things and lifestyle factors.
Sure. I always tell my patients the 2 biggest risk factors are being a woman and getting older. So unfortunately, those things are just unavoidable. Like you said, some of the other important ones, family history and a genetic mutation, if you have that, are really important. There are some hormonal factors, and there are lifestyle factors that can affect risk for breast cancer.
Okay, so let's talk about those.
Yeah. Fortunately, the things that help people not get breast cancer are the same ones that keep you healthy in general. Sure. They help prevent things like diabetes or heart disease, and those are staying healthy, being active, trying to maintain a good body weight, limiting alcohol, and not smoking.
Okay, perfect. Yeah, it really is. It's general health things that we should all be doing every day.
The same things your doctor has probably already told you.
Exactly.
Yeah.
And as we said, though, it is one of the most common cancers for women. Should they become diagnosed? Let's talk about treatment options and what they should be looking for.
Yeah. Treatment for breast cancer is really personalized. So each person is going to have a different kind of breast cancer at a different stage, and their treatment options will be unique. But in general, we have a few options. Those are things like surgery, radiation, chemotherapy and immunotherapy, and also endocrine therapy.
Okay.
So that will be, we use a team-based approach to figure out what's best for each patient and apply those things.
Yeah, and let's dive deeper into that and what Trinity Health offers for patients when it comes to screening, when it comes to diagnosis, when it comes to treatment.
Yeah, awesome. We have, starting out, hopefully you're not affected by breast cancer and you need a screening. We have multiple locations for screenings, including a mobile unit. And that mobile unit has the same technology for 3D mammograms, because that's something that is a miss. Some people don't feel comfortable on the mobile unit. It's great. So there are screening locations. And then in our breast centers, we have high-risk programs. We have genetic counseling. And for those people who do have a diagnosis of breast cancer, We are able to treat all under one location. We have financial counselors. We have nurse navigators. We even have a boutique that helps with wig and mastectomy fittings. So we're really pretty comprehensive.
Wow. Okay. So if someone, obviously if they want to get a mammogram, or if someone, wants to look into that care through Trinity, what do they need to know?
Well, you need to be 40.
Yep.
Or get a high-risk screening from us. Certainly there are some people younger than that can have a screening. And otherwise, give us a call. You don't need to have an order from your doctor, like we said. Yep. And women who are uninsured can also get a mammogram.
Wow.
So please just give us a call.
Okay. Reducing all of those barriers for women out there.
Absolutely.
All right. Well, thank you so much. I appreciate your time.
Yeah, thank you for having me.
All right. You want to learn more? TrinityHealthMichigan.org. We'll be right back.